want to welcome you to Grand Rounds. Grand Rounds is winding down for the year. We're close to our finish, but we're saving the best for the last. And it's my privilege this morning to introduce our Grand Round speaker, Dr. Siu-Hin, who is Director of Advanced Heart Failure over on our United campus, works with 5 other colleagues on that campus. Siu-Hin is a product of the Mayo Clinic's Cardiology Fellowship Program, and he was an assistant professor at the Mayo Clinic for some time and came to us from Texas. And we're extremely happy to have him. He's going to, by the way, have his master's degree in business administration from the Carlson School next week, I understand, so congratulations. He's going to speak to us this morning on his passion in heart failure. And you may wonder why I put this picture up here, but he is an avid traveler and a photographer, and this is a photograph, I presume, from Antarctica. And I believe these are Gen 2 penguins. Yeah. And so here's the connection. Gen 2 penguins, as I have learned, drink predominantly salt water, and their diet is mostly salt. So you wonder, why in the heck would they not have horrible hypertension and heart failure, right? But they don't. And the physiology explains that they have a specialized gland around their eye that secretes salt, almost pure salt, and it drips out of their beak, and that's how they are able to prevent heart failure. So perhaps we could look at that as an avenue for humans someday. But in the meantime, I'm going to turn the microphone over to you. I guess you're already wired up. Thank you.
Thank you so much, Dr. Sharkey. I did not know you were have an interest in penguins, but absolutely. Yeah, these are the Gen 2 penguins. Gen 2 and the chin strap and the Adelie penguins are the most common that I saw. I'll talk a little bit about my trip, actually, in relation to this talk. So what I'd like to talk about today is building high-performance teams in cardiovascular care. This is a huge topic. I'd like to incorporate kind of everything I've learned over the past couple years in my executive MBA program into less than an hour. Of basically, it's a very evidence-based field, but kind of the highlights, and then I want to end with kind of a practical framework that we can all use to develop high-performance teams in whichever setting you are, whether it's a clinical setting, administrative setting, or the research setting. First of all, I would like to thank everyone, definitely Dr. Sharkey for that wonderful introduction. I'd like to thank Ross and Maya, just a lot of people here at the Minneapolis Heart Institute Foundation that makes this happen. And of course, the leadership, the MHIF, Chris Fortman and kind of my leaders and my mentors, both on the Abbott campus and the United campus, that have made this happen. I'll sprinkle in examples throughout this talk. So I have no disclosures, with the exception that there is technically 1 week to go before I get my diploma for my MBA program. So excited about that. So let's dive in. And I want to talk about the 3 main objectives of the talk today. The first is to highlight the clinical rationale and the guideline-endorsed need for team-based cardiovascular care. Then we'll kind of dive a little bit deeper and explore how team-based structures, what are the characteristics of teams that help improve efficiency, innovation, and outcomes in healthcare delivery. And then finally, provide a practical framework for how we can all create very high-performing, sustainable team-based models in cardiovascular practice and in whatever setting that we're in. So I'm going to start with a story about my trip to Antarctica. I went there last December, and I want to start with this because it really highlights the importance of teams. And that's what I encourage all of you to do, is as I tell the story, think about kind of what are the aspects of teamwork, what are the characteristics that lead to really high-performing teams, and why teamwork is so important for this expedition. So the closest distance to Antarctica, to the Antarctic Peninsula, is actually the southern tip of South America. And you travel there by boat. So the southern tip here, you see Argentina, and then you see Chile here. And the southern tip, right in this kind of triangular region, there's a city called Ushuaia, and that's been called one of the southernmost cities in the world, because that's where that's a port, basically, and that's where a lot of the ships and cruise ships and container ships enter and exit. So this is the starting point of the journey. And this here is the Drake Passage. And the idea here is that this is one of the most treacherous waters in the world, because if you think about the ocean currents, right, Antarctica is actually a circle if you look at it on top of the South Pole, and the currents go around and around and around the Antarctic Peninsula or the Antarctic continent. But here it's very narrow. So kind of if we think about fluid dynamics, the velocity, right? It's kind of like think of a valve, like a heart valve, right? The velocity is going to be really high here. So it's very treacherous waters, and sometimes it can be very still. There's the idea of this Drake Lake. Sometimes it's very still, but sometimes it's very treacherous. So the idea is you never know, right, what you're going to get, right? And the captain of the ship has to be very resilient. And he has to understand that, sometimes it might be a very easy journey, but sometimes it might not be. It has to be prepared, right? So the idea is, as we zoom in, kind of look at this ship, there's a lot of technology here, right, that helps kind of the ship navigate. You have your radar. But at the end of the day, you really don't know kind of where the ship is and where it's going. You have to kind of rely on your team to understand the hazards and whether or not it's actually safe to cross. So one of the stories is after crossing the very treacherous Drake Passage, there's a channel called the Lemire Channel. So in December, as we think about the seasons, right, it's opposite to us here in North America. So as we think about December, it's kind of the cold season, so the winter season, moving into the spring and summer. So things start warming up, the days get longer. And the idea is, the ice melts, gradually melt. So the Lemire Channel, this is a picture that I took, by the way, on the ship of the Drake Passage. This was one of the calmer days on the Drake Passage. And this is just a little bit of video showing kind of 2 days, basically, to cross the Drake Passage. So a lot of motion sickness pills required, I'd say. But this is the idea here. So this huge ship, right, has to cross these tiny channels. So how do you know if it's safe or not? And the captain ended up telling us, he was very proud of this, he ended up telling us that we were the first ship of the season to actually cross the Lemire Channel, right? Because earlier in the season, the winter season there, it's completely frozen over, right? And you cannot cross. These ships have a sharp hull, so it can technically cut through ice, but you also don't want to sink, right? Like 2 days away from anywhere else will be kind of stuck there. So the idea is the captain relies on their team, right? They're technologists. The captain relies on the crew, right? The eyes. On the bridge, if you see the bridge here, where they're navigating from, it's actually pretty narrow, right? And you can't really see much. So you really rely on the team and the teamwork, right? So, they all have a common purpose. We know the plan. They have a plan. They have a purpose, right? And they work together in order to navigate these treacherous waters. So this is when we actually got to the entrance of the Lemire Channel. And this was a question, right? Everyone thought this was not passable because you could see the iceberg there. But we ended up actually navigating through this, right? And the captain he spoke at the end of this. He was very proud, but he said he based it all on the team. It's because of the incredible teamwork that made this happen. So with that story, I'd like to kind of move on and talk a little bit about how it relates to cardiology and building teams and the concepts that are very important. So objective 1, we're going to talk about the rationale and the evidence for team-based cardiovascular care. I'm going to go through kind of a series of slides that talk about who, what, when, where, and why of team-based care. We're going to talk about an example of the amyloid team that we have developed here at the Minneapolis Heart Institute with the leadership of Dr. Peter Ekman from the heart failure section. We've kind of really built up this important teamwork and kind of how the components that make it effective. We'll refer to the 2022 heart failure guidelines. I'm going to give a lot of heart failure examples because that's kind of my realm. And then we're going to talk about how multidisciplinary care improves outcomes and evidence behind it and evidence in the guidelines. So just like navigating Antarctica, the success in terms of teamwork requires consistency, resilience, and a shared purpose. So who is on this cardiovascular team, right? There's really a lot of people. There's the cardiologist. If we think about the providers that directly treat patients, we have the advanced practice provider, registered nurses, pharmacists, social workers, cardio rehab, geneticists, dietitian. These are people who directly work with patients. And then we have the bigger team, right? So all of these direct providers interact with the infrastructure and the foundation, so to say. So we get referrals from primary care physicians, MHIF research, clinical research, mental health professionals, operations and admin. Very important to make sure that the clinic and the hospital runs as it should. Palliative care, device technicians, medical specialists. So really a lot of different people. And what exactly are teams? Are teams just people that sit together in a room? If we think about a workroom, right? If you have everyone sitting in there, are they a team? They're geographically located in the same place, right? So that's not really a team. So I think what we need to start off with is the definition of a team. And these are two books that I highly recommend. They're resources when I learned about the importance of team and organizational behaviors. On the left is the book Teams at Work, and talks about the principles and the drivers for what makes effective teams. And on the right is Amy Edmondson, who's from the Harvard Business School, this book called Teaming. So the idea that the team is a verb, it's not really a noun. It's not something, it's what you do. Okay. So if we define kind of what a team is, right, there are two important principles of a team. A team is a group of individuals who work together with shared goals, right, and interdependent outcomes. So if we think about the Antarctic expedition, right, we're all trying to get there. We have a plan, right? And we all have interdependent outcomes. If the ship, we're on the same boat, literally, right? If the ship sinks, we all have the same outcomes. So that is what a team, not necessarily geographically located in the same place. Now with remote work, I mean, teams could span the entire globe, right? We think about research, a research team, right? They could be spread out very far away. It could be in different time periods too. So it's really, these are the two defining features, shared goals and interdependent outcomes, right? And this is from one of my professors that specializes in organizational behavior and teamwork, Mary Zelmer Broom from the Carlson School of Management here at the University of Minnesota, along with Amy Edmondson from Harvard, saying that a team is not a thing. A team is a moving target, right? So that's kind of how I would like to set the stage. And if we think about what results in high-performing teams, right? There are really three components that make teams effective, right? There has to be sustained performance. We'll go back to our example again with the Antarctic expedition. So they do this every single week, right? We go like as passengers and tourists, we go on one, once in a lifetime trip. They do this every single week, right? Back to back to back to back. So they have to have sustained performance. It can't just happen once, right? The team has to be resilient. So this is the idea that the Drake Passage could be super calm, could be like a lake, right? Or it could be very treacherous, right? They've talked about stories like sometimes, yeah, the waves are so bad, but the waves are so bad, it can break a window, right? If it comes up on the ship, and that's not good. So you have to be resilient, you have to be prepared for those situations, right, when things can go bad. It might not happen. Most of the time it doesn't happen. We hope it doesn't happen. but what do you do if it does, right? And this is especially important in healthcare too, when we think about many sorts of clinical situations. And then the last part is vitality. And I think this is, the other two are kind of more common sense. Vitality is this idea that you can't break the team while you're achieving your goal, right? Because it's the idea of a sustained performance. It's a long-term thing, right? So if you burn out your team, if you break the team, achieving your goal, your outcome might be very good, but you're not going to get long-lasting success, right? So the people on the boat, on the ship to Antarctica, are happy, are enthusiastic. They're happy to do this week after week after week, right? And that is not, though, that's not a fluke. That's built into the system, right? There are certain things and settings that make a very potentially repetitive occupation, highly rewarding. So we'll talk about kind of these three components that really contribute to high-performing teams. So then we talk about the when and where, and this is where I'd like to introduce kind of some examples from cardiology and heart failure. So if we think about where in cardiology that teams are very important, we think about clinics, right? Cardiology clinics. So I'm in the heart failure realm, so heart failure clinics, certainly a very important team-based effort. Cardiologists, advanced practicing providers, nurses, a lot of coordination involved. Dr. Ekman and Dr. Mosey Bennett are involved in what we've kind of developed here as the CHAMP program. So the idea is a chronic heart failure management program. So it's this coordination of discharge. So when someone leaves the hospital, right, how do we make sure we get them follow-up in the heart failure clinic, right? That requires a lot of coordination. And it's not just the cardiologist, it's not just the physician, doing everything. Patients need education, patients need follow-ups, phone calls, and medications have to be reconciled. So it's really a very complex, coordinated program. We think about teams in shock. We think about teams for ACLS, right, and cardiac resuscitation. We think about valve teams, right? So there are really a lot of teams in the clinical setting. There are a lot of teams in the research setting as well. We're here at the MHIF. So we kind of think about teams are really important everywhere in cardiology and in medicine. As an example, so I have a personal interest in amyloid cardiomyopathy. So if we think about the people that we work with in the clinic and in the program, right, we have to find the right people. And this we'll come back to this in the framework at the very end, how we create a high-performing team. But you need the right people. You need the right number of people on the team, right? So we think about, for amyloid, you need to start at outreach. So we think about, oftentimes patients come in through primary care or imaging. Maybe they get their echocardiogram and you suspect that there is some abnormality that leads to the referral for the amyloid clinic, right? So we need coordination. One of the initiatives we've developed with the Echo Lab at United is that if someone's interventricular septal diameter is greater than 15 millimeters, right, then we think about doing strain, right, to see if there's a strain pattern for amyloid. So it's really outreach, it's education, it's recruiting everyone, making sure we all have the same purpose. Everyone understands why we're doing this, right? And then coordination with other specialties as well. So orthopedic surgery, valve structural, these are areas that the patients have high risk of having amyloid cardiomyopathy. And then coordination with hematology oncology, because sometimes we pick up AL amyloid, which is treated with chemotherapy, rather than TTR amyloid cardiomyopathy. So that's kind of the details of the amyloids for another time and another talk. But I just wanted to introduce how the idea of building highly effective teams is important in something when you're trying to build a clinical program. Also a couple shout outs. So over at the United side, with Dr. Ian Hackett, has really worked tirelessly to bring our nuclear imaging scan to detect TTR amyloid cardiomyopathy. That's kind of been instrumental, working with him, Dr. Liz Tui's leadership over at the United side as well. So let's talk a little bit about the evidence. Why are teams important? We've talked a lot about what teams are, when we have teams, right? So why are they important? So we can refer to the guidelines. So the 2022 American College of Cardiology and American Heart Association heart failure guidelines talk a lot about teams. Okay, multidisciplinary care and multidisciplinary teams improves outcomes, and this is based on evidence, right? It also improves efficiency and innovation. So let's go to the guidelines, and I've kind of highlighted in red how many times teams and multidisciplinary teams come up, right? So if we look at the 2022 heart failure guidelines, it's a class 1 level of evidence A recommendation that patients with heart failure should receive care from multidisciplinary teams. And then we dive a little bit deeper into the guidelines, right? So because of the complexity of heart failure management, heart failure care should be provided by multidisciplinary teams. And then kind of we dive a little bit deeper. This is a section about stage C heart failure, right? And how many look how many times multidisciplinary teams come up, right, in the guidelines. And these are based on trials, so randomized controlled trials. And I've highlighted kind of the outcomes on the bottom, right? They're related to reduction in mortality, readmission, and heart failure readmission, right? So the idea here is that teams are important in heart failure, right? And honestly, in cardiology in general, but these are the heart failure guidelines. And then they're associated based on trials and based on evidence with better outcomes. And that includes mortality and readmission. So this is why it's important. And if we go to the management literature and look at, this is an article from over a decade ago from the Harvard Business Review, but the idea of the benefits of keeping teams intact. And they kind of demonstrate examples, right? So if we look on the right here, they gave an example of a software firm. But the idea is increase in team familiarity, right, results in an improvement in outcomes. So we relate that to the clinical setting, right? Better clinical outcomes, and also improves operational efficiency and improves outcomes for the organization, right? There's less deviation from the budget. And the idea is there's overall improvement in performance, right? So both a clinical improvement and also organizational benefits as well. This article gives an example in the medical arena, and it talks about looking at a group of surgeons. They looked at orthopedic surgeons actually in particular, but the idea is they looked at surgeons who were kept intact, right, and were in teams versus those that move around a lot, right, and have different teams. So on the left here, the snippet, it says surgeons who worked at multiple hospitals found that their performance varied from facility to facility. And the idea is because they have varying levels of familiarity with the OR teams. And they looked at high-performing teams. So they looked at this group that performed procedures very efficiently. So a general procedure that takes 2 hours, they were able to perform in 20 minutes. Well, how did they do that? So they looked at the team, and the idea is that the surgeon had 2 dedicated teams in 2 ORs adjacent to one another. The teams have worked together for 18 years. So the surgeon knows the nurses, knows the teams, and the surgeon is able to develop these innovative processes and techniques that's unique to him, but because he knows the team so well, they're able to work together and communicate together very efficiently. So the idea is when you have a high-performing team and you keep the team intact, then you can actually have more innovation. You can try different things, and you're more efficient, certainly. So the idea that these are some of the factors that lead to improved outcomes is perhaps because of some of these things, so greater innovation, greater efficiency. They're all very, very important. Okay, so that kind of concludes objective 1. This is a time-lapse video that I took on an Antarctic peninsula. The point of this is to remind us that we are only touching the tip of the iceberg. There is actually much more below the water than above the water. So we have an introduction with kind of the who, what, when, where, why. Next, we're going to talk about the specific characteristics and the foundation that makes teams important. So we move on to our second objective: teams improve outcomes through better structures. And I'll talk about specifically two components that are very important for having a very effective team. We talk about shared purpose, which we alluded to already earlier, and then this idea of psychological safety. And then we'll talk about team of teams and what that model is, and then the idea that multidisciplinary clinics foster innovation. So just like the Antarctica expedition, high performance teams thrive under pressure and they're resilient. So what's the anatomy of a good team? So there are many different components, and the books will talk about 7 components, 5 components, but I kind of want to distill it down to 2 main things, okay? The idea is a good team should have a shared purpose, and a good team should have psychological safety. And we'll kind of explore what each of these means. So shared purpose, where are we going? Okay, this one can be challenging in medicine because if we think about a typical clinical workday, right, we're kind of in our own silo. We're in our own clinic. We interact with our nurses, our advanced practicing providers, but we don't necessarily see other physicians. We don't know what other cardiologists are doing. We don't know what's happening in other areas of cardiology. So it's kind of hard to develop a shared purpose because we think about what we need, our own resources. We think about what type of research we're doing, but how does that fit in to the big picture, right? So shared purpose, there are 2 components. It's understanding what the shared purpose is and also communicating that shared purpose. Because sometimes you can have one or the other, right? You can know what the shared purpose is, but it's not communicated well to the other members of the team. Or you communicate really well, but you don't really understand the shared purpose. You only understand your own purpose. Right? So this actually comes from General Stanley McChrystal, who, after his career in the U.S. military, he was a kind of a renowned speaker. He taught at Yale and basically applied a lot of these principles of teamwork to other aspects, to business, right? And I think a lot of these leadership teamwork principles we really learn from high-performing areas like the military or sports or athletes. We learn a lot of these from athletes. So what he said is everyone must understand the mission, the context, and how their piece connects to the whole. And I think we struggle with this in medicine, right? We struggle with this in research. We certainly struggle with this in clinical medicine, really understanding the big picture. And it's developing the idea, this culture of trust, right? So, earlier in the season, we had Professor Axa here, one of my professors at the Carlson School, and he talked about this idea of culture and trust. And that kind of dives into the second part of having an effective team, this idea of psychological safety, right? So what does this mean? I think for all of us who do procedures, right, I'm doing a transesophageal echocardiogram in the procedural area, we understand this idea of psychological safety, right? And we're taught this in medical school, the idea of being able to speak up, ask questions, admit mistakes, or offer ideas without fear of embarrassment, punishment, or retribution, right? In the past, decades and decades ago, this was not great in the procedural area, right? You have your hierarchy, you have your surgeon, right? You have your physicians at the top, and nobody else says anything, right? They just follow orders, basically. But the idea is there are mistakes. You can never be perfect, right? So in organizational development and teamwork, we talk about the Swiss cheese model, where it's not only one hole that you go through, right? But you have many, many layers of safety. But the idea of psychological safety is important because if you don't have that, right? If people are afraid of being embarrassed or punished, they're not going to speak up, right? And honestly, for us as physicians and clinicians, it's kind of a win-win, right, for both sides. It's certainly better clinical outcomes for patients, but these are times when your team can suggest ideas, to save you, basically. So we think about, again, high-performing areas, athletes, military, right? This is absolutely essential. And you think of a military mission where someone on the team has information and knows something but doesn't say anything. I mean, this could be life or death, right, on the mission. It's the same thing in clinical medicine, right? If someone doesn't say anything, right, and you are actually thinking of operating on the wrong side of the body, right, you want someone to say something, right? You want that to be stopped. Now, nowadays, we have a lot of checklists, we have a lot of ideas and barriers to stop that from happening, but that could not have developed without psychological safety. So Google has kind of looked at this, right? In Google, they called it Project Aristotle, the idea of looking at within their own organization the keys to successful teams, right? And they really identified 5 different things, the foundation being psychological safety, right? That is kind of the most important thing. Dependability, structure and clarity, meaning of work, and impact of work, right? Impact of work being the very top. And that's oftentimes what we talk about as motivating factors for employees if we talk about human resources. But I think this could be distilled down into those 2 big things, right? Psychological safety and then having a shared purpose. Communicating that, being reliable about that, having a structure that fosters that, right? And having good impact and meaning. So here's kind of another example. This is actually our capstone international trip to Europe. This is a picture that I took of the Atletico de Madrid Metropolitan Soccer Stadium in Madrid. And there's this idea of too much talent. So this is in the business literature. But the idea is that performance increases with talent, right? That's pretty common sense. But up to a point, right? Up to a point. And then actually, it can actually stagnate or sometimes even decline, right? And the idea and why I have that picture there is this is the concept, and this has been analyzed, the Galacticos of Real Madrid, right, in the 2000s. So the idea was, so Real Madrid is one of the top teams, generally along with Barcelona, in La Liga, in the Spanish soccer league. I think they had the El Clasico actually pretty recently. So for those of you who are soccer fans, but the idea is, so Real Madrid in the mid 2000s really wanted to have like a powerhouse team, and the idea is they wanted like the galaxy. So that's the idea of the Galacticos. But they basically, they recruited Zidane, Ronaldo, Beckham, all these big names in soccer, right? All these soccer stars. And to build this huge team, right, with stars, all stars. But they actually underperformed, right? They struggled to win the big leagues. And why is that, right? That doesn't really make sense. You have all these superstars, right? Really, should have a easily winning team, right? You think about, for those of you who watch TV, you can think about Ted Lasso, for example, actually explores this idea, right? But it's imbalance, right? The roles are imbalanced. You have egos, right? You don't have a shared purpose. You might not have psychological safety. People might not say anything because you have 1 or 2 people or a group of people kind of coming up with the plays or the ideas. You have a lack of discipline, there's fragmentation, fault lines, there are many things we can kind of talk about. But I think this is important, right, in the clinical setting. And this is important when we think about how you want to construct that team, right? So do we want a single team with all the all-stars, right? Because performance, up to a point, can actually decline after a while. So I think this is a very, I'd say, almost counterintuitive at times, because you'd think you want absolutely the best people, and that is true up to a point, though. And then the teamwork component becomes just as important as the technical capabilities. So the idea of ego and hierarchy, coordination costs, so this concept of the complexity of decision making, right? If you have all stars, who actually makes the final decision? Psychological safety drops, right? That's one of the 2 pillars of an effective team. And then the lack of a shared mental model. Not everyone is kind of going in the same direction with a shared purpose. So kind of back to the title of the talk, from silos to synergy. So I just wanted to explore kind of for cardiology, and then on the next slide, specifically for heart failure, kind of traditionally what things have been, and this idea of team of teams that General McChrystal talks about being very effective in the model that we should be moving towards. So if we think about the structure, traditionally for cardiology and for medicine, we have very siloed subspecialties, right? We have our own little work area. We don't really know what the next hallway is doing, right? And we certainly don't have a shared purpose, right? So by moving to the synergy model, we have interconnected specialty teams. As heart failure, we work with electrophysiology to talk about devices and ablations. We work with valve, talk about aortic stenosis, mitral regurgitation. We really connect with other parts, other specialty teams that we generally don't interact with on a day-to-day basis seeing patients. For leadership, it's hard to know what happens in each individual area, right? So there's a shift from hierarchical leadership to empowering the front line. Now, the communication is important. That communication has to be fed back. But the idea is that, each subspecialty is empowered to perform well, but at the same time, communicate and understand that shared purpose. That will really optimize every kind of subspecialty section. Communication shifts from fragmented, delayed type of communication to real-time cross-team transparency. I think technology helps a lot with that, particularly post-pandemic. I think it really empowers us to be able to communicate better. And then purpose, right? Division-specific, where we're asking for resources, hoarding resources, to kind of having a shared mission, understanding how everyone contributes to the bigger picture, and having resilience, right? Again, that's one of the three important parts of an effective team, having resilience. So rather than dependent on a few individuals, everyone knows the purpose, it's distributed equally, or at least distributed with a distributed capability where everyone understands their technical expertise and it can adapt under stress. If we talk about heart failure, kind of diving into a deeper example specifically for heart failure, so admissions, right? Whereas traditionally it was a heart failure team evaluates the patient, puts in consults for other subspecialties. The team of team approach would suggest that electrophysiology, imaging, cardiac catheterization is all coordinated with heart failure, and there's seamless communication there. In terms of diagnostics, again, traditional approach where orders are just put in, there's delays due to scheduling. The echo labs, and electrophysiology workup are all done coordinated seamlessly. In terms of care transition, so this is the CHAMP program. Again, with a fragmented discharge planning, shifts towards a coordinated plan with nursing, social work, clinic teams. The idea that all these components of a good team are coordinated and help deliver a very effective care plan for the patient. And then the outcomes, where the traditional approach, it's very variable, it's not very resilient, it doesn't adapt. That in a team of teams approach, there's greater efficiency, there's greater safety, better outcomes, and better patient satisfaction. Okay, so that's kind of the second objective. So just to recap, in the first objective, we talked about the who, what, when, where, why of teams. In the second objective, we dived into the characteristics, right? This idea of shared purpose and psychological safety as the foundation of a very good team. And then this last objective, I want to talk a little bit about developing a structure, something easy that we can implement either formally, in my kind of educational journey, sometimes at the beginning of a project, we do this formally, we write it down, right? Or you can do this informally and think about these concepts, right? But having a practical framework for how you can develop your own high-performing teams, whatever environment you're in. So I'll kind of talk about the aspects of the team charter, knowing your team, setting the expectations, and how to handle problems, right? And it's building a foundation. It's like a base camp. Okay, it starts with the right foundation, and you can build on top of there. So we start with the team. So whenever you think about developing a team, whether this is you're doing a procedure or surgery, and you think about who you want on your team, right? Or you're developing a new initiative, you're developing an amyloid program, or you think about who are the members that you want on the team, right? So size is important. Think about how big you want your team to be. There's actually research on this, and apparently the optimal number is 4.6. So somewhere between 4 and 5 people is the optimum team, right? And if you think about this, this kind of makes sense. So what's the research behind this, right? So you have two small teams, you have 2 or 3 people, and you don't have enough expertise, you don't have enough buy-in, right? You have 10 or 20 people and nothing ever happens, right? Because everyone has an idea and things are not efficient. So this is kind of the balance, right? And this is balancing expertise, right? So knowledge and capabilities, right? So you need both. You need people who are content experts, and you need people who can get things done, right? So kind of having a mix of that, assessing the collaboration readiness, right? So it's not just about all stars, but it's about stars that can work together. If you have 2 people that really, really, really don't like each other, it might be challenging. It's not impossible, but those are the things you want to think about when you're forming a team. And then the last point, kind of diversity, it can also be a little bit of a challenge, right? So it's kind of that balance, again, the optimal size of the team, right? So if you don't have any diversity, you don't have new ideas, you don't really have innovation, everyone just goes along the same path, right? But if you have too much diversity, it could be challenging, right, to form a consensus, to make decisions. There's this idea of fault lines that can develop, right, and that does not make for effective teams. So the general idea is that this is a balance, right? You kind of want everything somewhere in between. You don't want too big a team, you don't want too small a team, right? You don't want too narrow in expertise, but you also don't want too broad. So that's kind of the idea when you're forming whatever team, clinical team, research team, procedural team, think about what's the size of a team, who do you want on the team. Then the next part, the second part, is this idea of setting expectations, right? And this is, I think, something we probably all know about ourselves, but something that's not necessarily always communicated with other people. So having clear roles and responsibilities and communication, and having metrics, I think this is very important, things that are outcomes, right, that are specific and measurable. Like we know that from clinical research, right? We look at mortality, right? We look at hospitalization, right? We have numbers to actually measure it, right? But that should also be the case for clinical teams, procedural teams. If we're setting a new clinic, we think about, how do we define success, right? And I think that should be defined early on, and that should be communicated, right, to everyone early on. And then this kind of the last part here was the time and pacing styles, right? So this is the idea that you have a deadline, right, and you have time on the x-axis, and this is kind of the activity level, right? So we think like everyone is kind of like this, where it's like even effort from the beginning to end, but this is actually probably the least common, right? We're generally one of these other things, right? So here's kind of the procrastinator, right? Kind of all the activity ramps up towards the deadline. I'll admit I'm probably more in this category right here. Some people are front-loaded, right? They do all their work at the beginning. It kind of tapers off. Some people are both, right? So front-loaded, then they take a break and then come back to it at the end towards the deadline. Is there one right way to do it? There is not one right way to do it. But the point of including the pacing styles in here is that when you form a team, right, you have to communicate this, right? And it's actually okay that people are different. So if you think about, maybe you have a member of your team that's like this at the beginning, right? So they get the project started, right? And that's fine. You have someone that's, like this, right? And that's also fine, and they wrap up the project. But I think this has to be communicated, right, at the beginning. If you don't communicate this, right, then maybe this person who does everything up front will think this person is super lazy, right? And this person over here will think this person is super demanding, So I think it's okay, right? There's no one right or wrong answer. And if everyone's the same style too, that's great too, right? Then everyone's on the same page. But this has to be communicated either formally or informally at the beginning. Idea being like we're all on the same page, we have a shared purpose, and we'll all make the deadline. Okay, and then the third component, right, of a team charter. So the idea is when problems arise, how do we solve it? And importantly, how do we make decisions, right? So this is a conflict model. And I think we kind of know this intuitively, right? But there are different styles that people use to resolve conflicts, right? So there's collaboration, so the idea is assertiveness and cooperation, right? So the two spectrums, you have high assertiveness, high cooperation, that's collaborating, right? We can both get what we need. And then on the opposite end of the spectrum, there's avoiding, right? Low assertiveness, low cooperation. So we delay, basically, kind of, we'll address this later, right? And then we have the other corners, so competing, right? So this is the idea, like, if we're negotiating, it's distributive negotiating. The idea of like, if I get more, right, you get less. There's only a fixed size of the pie. So you're competing with the other person. And the accommodating is you just kind of, you let the other person win, right? Low assertiveness, high cooperation, and compromising in the center. Is there a right way? So we think maybe collaborating is the best, right? But it's actually, the concept here is there is no one right way. It depends on the situation, right? So if you're negotiating with someone, for example, sometimes this comes up, you pick your battles, right? So if it doesn't really matter to you, it's not that important, maybe avoiding or accommodating is the best solution, right? What are the advantages here? So for low assertiveness, you build the team vitality, right? Remember the three components. We think about outcomes, right? We want to meet the metrics, we want to meet the outcomes. But if you're avoiding or accommodating, you actually you let other people have some wins, right? You build the team vitality. People are more motivated, you sustain that team, you prevent people from burning out, right? So there's not one right or wrong way to resolve conflict. The idea is what the particular situation is, right? What you're trying to achieve, which parts of that triangle, right? The three components of the team you're trying to achieve, right? And you decide, which conflict that you can switch, right, for particular situations, right? If it's something that's really, really important and you're an expert you're content expert, right, and you know that's the right thing to do, maybe you go competing, right? There's not a discussion, right? This has to be this way. So you have to kind of pick your battles and you can switch. But again, I think this is something, if you're working in a team, this should be communicated as well, right? And the team members should kind of understand this about one another. So kind of this idea of a team charter, right? So team goals, who do you want on your team? How big is your team? Roles and responsibilities. How do you make decisions? Interactions, communication, meeting, and conflict resolution. And this could be formal, again, you can write it down. We did this, as part of my MBA education. It could be informal, right? You go into an OR, you think about, who's on your team, what the roles and responsibilities are for everyone, how to interact if there's something goes wrong, right? Someone's bleeding, deoxygenating, right? What is the process and the procedure, and what do people do? This is kind of the bystander effect. So, we talk about this in ACLS training. I just recently had my kind of recertification training, and the idea is if everyone thinks someone else is going to do it, then nothing's gonna happen, right? So if you think about a code, someone without a pulse, and you just kind of look at one another, right? And nobody does anything. That's not really helpful. So the idea is, you think about a team from a team-based setting, right? You see someone unresponsive, you check their pulse, they don't have a pulse, right? What they teach us in ACLS is you look someone in the eye, right? You say their name, John, get the ACD, and call 911. Be very clear about what you want to do, and part of it is being a leader. That's kind of being a leader in that situation, right? You want to communicate. You want to communicate the roles and responsibilities. You want to make it clear why, what's happening, and that actually gets stuff done, right? Rather than all assuming, right? And then nothing ever happens. Okay, so in conclusion, kind of wrap this up. What do a cardiology healthcare team and Antarctic expedition have in common? They succeed or fail based on the strength of their team. Right? And we talk about the 3 objectives from today. So the guidelines and the evidence for why team-based care is important. We looked at the 2022 ACC-AHA heart failure guidelines. Shared purpose and psychological safety are the 2 essential components and the structural elements for building a high-performance team. And then the third part was that practical framework. We think about, who you want on the team, developing that structure, thinking about the roles and responsibilities, communicating, and then how do you make decisions and how do you resolve conflict. And like a successful expedition, leading and having good teamwork in modern medicine requires planning, okay, and a vision. Right? So in summary, kind of 3 big takeaways. Clinical evidence supports the importance of teamwork. Business and systems thinking demand it. And then now you are empowered with the knowledge, right? And you can lead it in whatever setting you're in, whether it's a clinical setting, administrative setting, research setting, surgical or procedural setting. You can build a high-performing team with the concepts that we've talked about today. I'm going to kind of come back to this picture. So not only is this one of my favorite pictures, I took this picture with my iPhone, by the way, so I did not have any particular gear. But it's also this idea of teamwork, right? You can see the Gen 2 penguins all looking the same direction. The penguins in general, they don't really have a lot of predators, right? Seals and leopard seals are one of the main predators. But generally, they're fairly safe in Antarctica, and they're very curious too. So they'll come up to you, right, if you're nearby. But they work together. They work together in a group, and you observe this behavior. It's this teamwork, right? So they look in the same direction. They check for threats. When they go into the water, right, the first penguin that goes into the water is generally the highest risk because their predators are in the water, right? So after the first one goes into the water, then they all follow after. So there's really a lot of teamwork. I think, that's one of the biggest highlights, in addition, of course, to the scenery and just experience. It's just observing how well the expedition team works together in these very harsh environments. It's also observing the teamwork that happens in nature, right? In the animals and the birds and the penguins, that I think it's these concepts that we have talked about today. So thank you very much, and I'm happy to take any questions.
Peter, I noticed I'd like to hear your thoughts on how this plays into your division and your thoughts.
First of all, I'm glad that we have the psychological safety to talk about this. And I think, a good example from my standpoint is that, I think Dr. Wan has done a nice job putting together an amyloid team and helping, build that as a hallmark of the part of the team that is at United. I think, we've also tried to work together to do some projects such as identifying suitable referrals, reducing readmissions, are some of the teams that we've had. And so I think, I'm really glad to hear this. I think this is a fantastic presentation, Siu-Hin. A question that I have is, what do you see as some of the biggest obstacles to creating more effective teams and, continue? This is a never-ending process. Obviously, teams are always forming and devolving and evolving in terms of what we're focusing on. What do you see as the biggest challenges to go to the next level?
Yeah, absolutely. And first of all, thank you so much, Dr. Ekman, for your leadership. Really kind of transformed the heart failure department here. So I think I appreciate the question. You probably you you're kind of an expert who are experiencing, all of this as well. I think with regards to the question of the challenges, right, and the barriers to teams, I think at a place like this, at Minneapolis Heart Institute, we have a ton of stars, right? We have so many really intelligent, bright people in research, in clinical medicine, right? And it's this concept of, fault lines that can develop. So you kind of have your own group, you have your own group of people that you trust very well in the culture that works very well. But it's like how those pieces fit together, right? In an organization as big as this, the bigger the organization, the more challenging it is. So, one of the barriers, and I think, potentially leading to the solution, is how do we kind of communicate that, right? So, I think we all, in medicine, it's challenging, right? We all need more resources to do what we need to do. But what are creative ways, perhaps, to share those resources? What are ways to communicate, to really elucidate exactly what we need and why, right? More importantly. And that might bring up actually creative solutions that we have not talked about. I think Dr. Ekman certainly, with your leadership, it has been a great help to the United side to have some of the resources over at the Abbott Northwestern side, right? And to have some of those expertise and getting some of those knowledge and resources. So I think that probably is the biggest challenge of a big organization, is really communicating and having that shared purpose. And it's hard because we have a lot of stars here, right, at Minneapolis Heart Institute. And it's kind of so we have that component, right? We have a technical expertise, we're very successful people, but it's putting everyone together, right, and really having that shared purpose. And a lot of leaders here, right, Dr. Ekman, Dr. Tui, certainly Dr. Katsianis have kind of really tried, it's a challenge, but tried to put all that together into a shared purpose. So I don't know if that kind of answered your question, but.
And I think, like I said, it's kind of a never-ending battle. I think one of the things I struggle with is prioritization, where, I wish there were 48 hours in a day. There's never enough time to get done all the things that we want to get done. And I think that's another element of the communication, is having a shared purpose and shared goals. And I think those things are essential as well. But
and I think, kind of one additional thing is it is up to us, right, as clinical leaders, I think, to be leaders. So we didn't kind of, leadership is another topic of its own, separate from teamwork. But I think sometimes we're very focused on metrics, right, and the operations and kind of other aspects kind of work to meet those metrics, right? But I think we as leaders have to really set the tone, because we, as with experts in clinical medicine, understand the long-term strategy, understand the nuances, understand the landscape and the environment. And if we don't communicate that well, then the challenge is we might be able to meet the metrics, but they might not be the right metrics long-term.
now it's your turn, Scott.
But I really enjoyed that, and obviously the Carlson schools taught you well. What do they say about dealing with the Ronaldos?
Yeah. This is the HR class. So yeah, I think it's certainly a challenge, right? Because you want the stars, you want the ones with the technical expertise, but it's finding kind of the right home, right, and the right environment. So, of course, I think everyone has egos, and everyone has their desire to achieve something, right? The idea is, I think we start with communicating, right? We communicate these concepts, we talk about it. We have a psychologically safe environment to discuss, some of our concerns. Now, ideally, of course, people are receptive and they're more open to collaborating, but it's a challenge, and some people are not. Well, then I think it's kind of finding the right role for them. Maybe some people are They prefer kind of more independent work environment. They have a bigger challenge, right, with collaborating. Then the idea is not to fire anyone you don't like or is not a team player, right? That's kind of not effective either. But the idea is to have them in an environment that kind of suits their personality and their role and their goals, right? So it might be a more independent environment. So I think that's one of the challenges, and that's certainly one thing I think no organization is good at. But having the flexibility for employees to find the place that fits them well, right? I think when someone joins an organization, they're kind of pigeonholed into one role, right? But that might discover that that's not the ideal setting for them. So if it's a Ronaldo, right? We still need the Ronaldo to score the goal, right? But maybe they don't control everything. They're not also the playmaker. They don't worry about defense. We have other people kind of in charge of those areas. So certainly it's still very important. Everyone's very important, but it's kind of finding the right role for them based on their collaborativeness, based on their expertise, and so forth.
Anyone else? Thank you very much. That was a wonderful talk.